Here are 5 things to consider before choosing your penile implant. Hey everyone, my name is Dr. Akash Kapadia. I am a urologist and a penile implant specialist in Atlanta, Georgia. I specialize in both Boston Scientific and Coloplast implants, and I'm here to tell you about the details of each implant and 5 things you should look at before choosing your penile implant. Number 1 is penile implant cylinders. Here I have with me Boston Scientific cylinders as well as Coloplast cylinders. Okay, let's lay them side by side so you can tell the difference. If you'll notice, the Boston Scientific cylinders tend to be a little bit narrower in flaccid appearance compared to the Boston Scientific cylinder. They also sit a little bit rounder and flush compared to the Coloplast cylinders, which do appear to be flat. And that's what we're going to talk about in just a moment. With the Boston Scientific cylinder first, we notice that it has a very soft, natural feel to it. Okay, this is because the cylinders are designed with 2 layers of silicone with an intervening layer of fabric. This design allows the device to not only have the soft, natural feel, but also expand gradually. The 2 device types are CX and LGX, which means controlled girth expansion or controlled length and girth expansion. If silicone expanded without control, it would continue to expand without any restriction. Which is why the fabric layer prevents it from doing so and allows for a gradual expansion fitting to the man's anatomy. And I think that's really important. So in my opinion, this cylinder has a very nice soft feel to it in the flaccid state and does tend to maintain a nice amount of rigidity and girth in the inflated state. Notice the tips of the implant. The Boston Scientific implant tends to have a slightly wider corporal tip. This ends up being near the head of the penis and can provide a little bit of width. So in men that have a really large glands, where I feel their corporal tips are going to be quite large, this tends to have a nice feel, a very natural feel to it. The next things to look at are the exit points of the tubing. The exit points of the tubing on the Boston Scientific implant tend to stick out just a little bit more than the Coloplast implant. And then finally, looking at the very back ends, the proximal tips of the Boston Scientific implant, they tend to be also a little bit wider compared to the Coloplast implant. Now let's compare that to a Coloplast cylinder. Now this is the Coloplast Titan. As we talked about, as you could tell right away, in the flaccid state, it tends to sit a little bit flatter, and that's because of the material. This is the BioFlex material. It's mostly composed of polyurethane along with some proprietary blend of material. But this allows the device to maintain its maximal girth, meaning it can expand beyond its capacity in comparison to a silicone implant. Now, let's look at the details of each. Here you can see that the distal tips are a little bit narrower. And this allows for, in many cases, a much more natural fit for the guy. And same things on the back end. The proximal tips are also quite narrow. And especially in men that have severe fibrosis, this can allow for a nice seating of the proximal tips. Now, when it comes to the penis being in the flaccid state, yes, there are some complaints about this cylinder having some flatness to it, and in some cases having these dog ears on the edges that you can see. In my experience, when that becomes a problem for men, most men are able to overcome this with simply inflating the implant to about 20% in its natural state, in the quote-unquote flaccid state for the guy, which for the most part allows the dog ears to pop back to normal position where there is no crink or kink in the implant. And the penis also appears to take a more normal, sort of rounded look to it rather than a flat look. Looking at the exit of the tubing here, you can see that it tends to be a little bit more flush to the cylinder compared to the exit tubing of the Boston implant. And in some cases, that is a true benefit, where you have a much narrower exit compared to a Boston Scientific implant. And then finally, in terms of rigidity, I think most specialists would tell you that the Coloplast implant tends to have much more coaxial rigidity, at least in a laboratory setting, compared to a Boston Scientific implant. Now, whether that translates to humans and normal sexual function, that's hard to know, but I can tell you with good confidence that most, if not all patients are extremely happy with their respective implants, both in the flaccid and the rigid state. So regardless of the brand you go with, satisfaction rate tends to be quite high, but making those nuanced decisions for the cylinder itself is very, very personal. Item number 2 is the pump itself. Let's be honest, that's the most important thing for many patients who are going to be using this implant. You have to be able to use the pump, and the pump has to satisfy you in terms of both inflation and deflation. So let's talk about the pumps. First up is Boston Scientific. As most of you know, now Boston Scientific has 2 pumps. The first and one of the older pumps is the MS momentary squeeze. This is what most people know out there on the Boston Scientific device. This has been around for a long time and with great reliability, and I'm a big fan of this pump compared to the new Tenasio pump, and we'll talk a little bit more about that. So here's the pump. You can tell that the pump has relative width to it, especially in what we call the shoulder area of the pump. You've got an inflate and you've got a deflate. There are a few things that I love about this pump and a few that I don't, and I'm going to go over a couple of those things. The first thing that I love about this pump is that I think it has the best deflate mechanism that's out there in the market compared to the 2 brands. Here you can see as I squeeze the button, it causes the penile implant to deflate. The really great thing about this particular make and model is the fact that it provides men with this haptic feedback, which I find to be very satisfactory. As you press this button, there's a vibration that carries out through the penis and the pump, which allows men to realize they're deflating. And in many cases, that's a very satisfactory feel. You know something's happening with the device, and that becomes a very reliable way for you to deflate. So I really love this mechanism of deflate. It's a very distinct button, and you can very clearly feel the vibration, which I think is great as a haptic feedback. And so I do think this pump is superior when it comes to deflation. Recently, Boston Scientific has come out with what's called the Tenasio pump. This is just within the last year or year and a half. There were some design changes made that mainly allowed for better inflation of the device, which I think this particular device may lag a little bit in comparison to the Coloplast pump. So the whole purpose of this device was to provide better inflation. So this is the Tenasio pump. What you might be able to appreciate right away is that it has a little bit less width. The shoulders are a little bit narrower compared to the MS, but it's a little bit longer than the MS pump and maybe a little bit wider in this aspect. One thing that we lose in this pump is that haptic feedback, the vibration that we're accustomed to with the MS touch. What you gain with this pump is this ability to squeeze down at the bottom rather than in the middle part of the pump. You're squeezing down at the bottom in order to get a higher volume per pump and a faster inflation. One of the complaints has been with the MS that it's a little bit harder to inflate for some men, and this is supposedly allowing men to have an easier time with inflation, mainly squeezing down here at the bottom and not requiring full squeezes, but rather small, tiny pumps and fast pumps to get to goal. One of my biggest dissatisfactions with this pump is the fact that you don't have the haptic feedback anymore. Now, for patients that have never had the MS pump, they may never care about it. For someone that's been doing these implants for a long time, that haptic feedback is second nature, and not having that I felt was a big loss. However, this pump tends to work quite well. Some of my patients are very happy with it, some of my patients are not, and so I still continue to use the MS pump with much more regularity than the Tenasio pump. Now let's talk about the Coloplast pumps. First up is the Genesis, or the classic pump, the OG, as I like to call it on the Coloplast side of things. This is one of my favorite pumps. It comes with a very sleek profile. You can see the shoulders are very narrow on this pump. The tubings are all in line. It has a very narrow profile on the deflate side of things. And the deflate bulb is nice and round and quite large in terms of volume per pump compared to the MS pump. The technical superiority of the MS Touch pump on the deflate side of things is I think on par here with the inflate side of things on the Coloplast Genesis pump. You can get a much higher pump volume per inflation, which I think is fantastic. Where it lags a little bit is on the deflate side of things. Here on this device, you have to press these bars or valves the whole time while you're deflating. So you've got 2 valves here that allow for that deflation process that are spring loaded, and compressing that valve the whole time is really critical. So while the inflation is excellent, the deflation can be a challenge for some men. I find that because it's a lower profile pump that it's relatively easy for men to be able to find these deflate valves. But once again, it's not a one-touch press and release. And I think that is one of the challenges. What I forgot to mention with this MS pump, it's a one press, hold for 4 seconds, and release pump, which allows for auto deflation, versus this requires compression the whole time in order to deflate. Now, pump number 2 is the one-touch pump designed by Coloplast. This is supposed to compete with the MS Touch pump by Boston Scientific. And in design itself, you can tell right away that this device is a little bit girthier in comparison to the Genesis when it comes to the shoulder of the pump. In fact, it matches the width of the pump quite similarly to the Boston Scientific. In length, it's also very, very similar, as you can tell. This has a nice wide inflate, which is identical to the Genesis pump. But now we've introduced this button right here for the deflate. And this is designed to be a one touch, which means you press and the cylinders automatically deflate. And this matches the technology of the MS Touch pump. The tubing now changes. It's not in line. It's more similar to the Boston Scientific tubing. This is the one-touch pump, and you can tell from a design standpoint, the button is much harder to appreciate on video and truthfully a little bit hard to feel under the skin. So you really have to be in tune with the device and really have to sort of identify this clearly and have to work at getting there. I call this a AA battery, where you have the nudge right here, which is the positive side, and then the negative side of the battery. And that's how I tend to explain it to patients when they're learning to inflate and deflate their one-touch pump. So there you have it. That's a review on the pumps themselves. Item number 3, Reservoir. Now this probably has less bearing on your decision, but it is important to know the different aspects of the Reservoir. Up first, I have the Boston Scientific Reservoir. Now this is a conceal reservoir. The reason it's called conceal is it's very, very flat in appearance. It works really well in men that have had prior surgeries in their abdomen or have had inguinal hernia repairs, prostatectomies. Those men, we tend to not use the perivesical space, the space near the bladder. We tend to put these devices in under the muscle, under the abdominal muscle. And so we want the men to not be able to feel those reservoirs. Particularly in those men, this reservoir does a great job of concealing and not having a bulge. And therefore it's called the conceal reservoir. There's also another reservoir made by Boston Scientific, which is spherical. If you'll imagine, it's a full round reservoir. I tend to use the conceal a lot for most of my patients because of the relative flatness of it and sort of not occupying too much space. In comparison to Coloplast, you have what's called the clover leaf reservoir. The clover leaf reservoir, it's got a shape like a clover leaf, and I can show you that in just a moment here as this device empties. It also takes a very flat appearance and almost a cloverleaf shape. The reason that this cylinder, the cloverleaf cylinder, is designed in such a way is because it can assume a very flat shape, much like the conceal, when it is empty. And not only that, but because of the design that they've created, this reservoir does not need to be filled to its maximal capacity. So this one goes to 100 mLs, this one goes to 125 mLs. However, this can be kept at a much lower volume, as low as 75 or 65 cc's, whatever the penile implant needs, and it'll maintain a nice shape without affecting the function of the reservoir. Whereas this particular reservoir does need to be filled to a certain volume to prevent from folding. That's the main concern. The reservoirs can fold, whereas this does not do that. So this allows more flexibility in the volume that can be put into the reservoir. This allows for a better concealed profile. One other step in the Coloplast reservoir is the fact that it has a valve to prevent autoinflation. This valve, when compressed, can allow for those cylinders to fill. However, the way it's designed, it prevents autoinflation of the implant. Item number 4, personal anatomy. I think this is one of the most important parts that don't get discussed very often. In other words, there are surgeons that only do Coloplast implants. There are surgeons that only do Boston Scientific implants. I'm here to tell you there is a right implant for every person. When I make decisions about the penile implant, I do put a very personal touch to the patient in making sure that they have the right implant. There are certain things that I'm looking for in anatomy. Prior surgeries, of course, that's really important in making decisions about the reservoir, but more importantly, how does the penis look? What's the anatomy like? What's the length like? What's the girth like? What is the tissue like? Is there fibrosis present? Is there Peyronie's disease present? What is the scrotum like? which pump is going to sit better in this scrotum, which approach is going to do better for this gentleman. Is it going to be an infrapubic approach or a penoscrotal approach? These are the very critical conversations to have with your surgeon about your personal anatomy and which implant is going to do better for your personal anatomy. Number 5 is your personal feel. Would you prefer an implant that looks more normal in the flaccid phase, that has a more natural appearance, or do you have a penis that has significant girth and does require an implant that has a little bit of higher coaxial rigidity? There are personal desires that patients have about their anatomy and their appearance, and I think that makes it for a very personal call. Finally, my last piece of advice here is go to a surgeon that does both Coloplast and Boston Scientific implants. They can give you an unbiased take on things, looking at your personal anatomy, your personal desire, your personal goals, and giving you the right penile implant.